From US Army counterintelligence to innovation in health tech industry, our guest, John Dodson, has taken an interesting career path. As a founder and CEO of Circulocity and SIMPL, John is transforming global health through AI-powered solutions. His innovative platforms are helping organizations worldwide improve health outcomes and supporting UN's Sustainable Development Goals. John, welcome to Health Tech Heroes.
Yeah, thanks a lot, Fasa. I appreciate being here and your time and the audience's time.
It is so amazing to have you here, John, all the way from U.S. Army and counterintelligence and improving health outcomes globally. What inspired this journey?
Yeah, thanks. It is, and I would call it almost a bookend, right? The U.S. Army counterintelligence special agent was almost another lifetime ago. Actually, 1987 to 1990. I enlisted in the Army and I had an exceptional experience. I was in charge of the tri-border zone of counterintelligence, counterespionage operations in the tri-border zone between East Germany, West Germany, and Czechoslovakia. So that's where I was there when the Iron Curtain fell, and that was really a almost a foundational event in my life. One, the history that was being, it was, I mean, we all saw it on television if we're old enough. Literally overnight, 17 million people were set free from what was essentially the largest prison in the history of mankind. These people were behind walls for decades under threat of arrest, prosecution, or even death for trying to cross into freedom. So I saw this, and even being able to relate it to my own experience, I saw these people overcoming in a peaceful way and being set free. And somehow that still, so if that's the one side of the bookend, the other side of the bookend is what I'm doing today. And in between there, was a bunch of normal books really about, I had a normal kind of career. I mean, I'm a sales guy, by choice, by training. I think it's exciting. And I spent years, I sold cars for 3 years. I was an investment advisor with a big brokerage house in New York City and then with a big bank for a few years. And then I almost kind of ran away to Mexico in the early 2000s, and I sold timeshare. I sold language training services. I've just been in sales my whole life. And about 20 years ago, I got into what's called the testing, inspection, and certification industry. And that's actually kind of prefaces how I ended up founding Circulocity and SIMPL. I worked in a program that that audited and inspected coffee suppliers for really like the world's largest coffee company all over the world against a private standard that they had developed. And so our organization went out and audited these suppliers to an environmental and social audit and did the job. And then, about 7, 8 years later, I became interested in global health inequity. I saw, that corporations, at least in, from what I had seen in testing and inspecting, didn't look at supplier health, and that, maybe they were buying coffee or cocoa or tea or textile products or mining products from primary producers. That's what we call them, that frontline or smallholder farmer, or um, that their health was a risk because, a female cocoa farmer in Ghana or Cote d'Ivoire might have a 20 or 30 times higher risk of dying in childbirth, in pregnancy and childbirth, right? Or just getting a urinary tract infection in a hospital, going in for treatment and getting a urinary tract infection. So those inequity, and it's really a lack of justice that somebody is supplying us a essential product. I'm sure many people would agree. Yeah, we got to have the coffee, the cocoa, the chocolate. We could do without, but we got to have the coffee. This inherent unfairness in their ability to live and thrive and continue to supply the product. And so I dove into that as just an area of interest. And I saw, because of my background in running supply chain audits, I saw kind of an opportunity to do something about it. And so I started an organization at the time. It was called the Supply Chain Health Consortium, which kind of says what it is, but a lot too many words. And our mission expanded as well, and we rebranded as Circulocity last year. Circular velocity, right? So accelerating and redefining what a circular economy is. And so in one of my earliest discussions, it was with the director of sustainable sourcing for a very large American cocoa company, chocolate company. And she said, John, nobody's leaning in this. I was, telling her about UN SDG number 3, health and well-being, and how we would collect data on suppliers' health indicators. And she said, John, nobody's leaning in this direction because we don't have the data. And I said, well, there you go. That's our job, is to get you the data so that you can make a decision on where to put in social impact dollars, where to bear their risks, and how can you not only address those risks and benefit the supplier communities, but also measure the risk, measure what your social impact is, measure if they're more productive and more resilient because of the actions that you've taken. So that kind of brought us here today. Circulocity is a nonprofit. We basically do field data collection. We're doing those surveys for not only health, and it's always aligned with UN SDGs, health and well-being, nutrition, poverty, infrastructure kind of questions. We look at the local clinics. So we collect the data for the manufacturer, the Swiss or the British or the American company. We visualize the data for them, right, on a BI dashboard. Here's the charts and graphs that show the risks, right? It might be cigarette smoking in Malaysia, Saudi Arabia, which we mentioned before we started recording. Only country in the world where the number one cause of death of men age 18 to 34 is car accidents, right? So that's a risk, right? Maybe you have suppliers or employees in Saudi Arabia, and that's their major risk. In East Africa, it's tuberculosis, HIV, malaria, women and children's mortality everywhere is an issue. So we collect the data for our clients. We help them visualize the risks. We make project recommendations to strengthen the health system. And then we can help them implement those projects and then go back and measure the impact. What did, if we decided to train, to attack maternal mortality rates. And so they train, deploy, and maintain skilled birth practitioners across their supplier communities. What was the reduction in the mortality rate? How many lives did we save? And of course, it opens up all kinds of doors to strengthening infrastructure, from internet, electricity, water and sanitation, delivery of medications, and even strengthening traditional healing systems as well, as the case might be.
My next question, whether you're looking at the environmental factors because of the work, or are you looking at lack of access to the healthcare in general?
Yeah, somewhat the working environment, but mostly it's their lived experience, right? Where they live, what are the structures that prevent them, and that structure may be traditional belief systems, right? And they don't know that in this example, that a urinary tract infection could come from raw beef or chicken, or it could come from a healthcare associated infection, right? And then how is that treated? How's it, one, diagnosed? How's it treated in what essentially are clinical deserts in many of these places, weak health systems? So then, and it depends on the health indicator. I mentioned seatbelt safety. It might be something where it's an education program. It's anti-smoking, smoking cessation programs. We did a project in Uganda, and I was surprised I hadn't done the research. The amount of alcoholism was scary. And I did not know this. Uganda is actually the fifth drunkest country in the world. It's the drunkest country in Africa. The average man drinks 20 liters of pure alcohol a year. And you could see it in their eyes. We did a test where we took pictures of about 50 coffee farmers' eyes, and you could see the jaundice in their eyes. So it's really about looking at the structures that cause the health inequities, right? And sometimes that's poverty, communication, lack of internet, lack of clean water, and what can be done to help, if you're a Swiss or American coffee company or a Swiss cocoa company, what can you do, that makes sense? Really, the beauty, go ahead.
They have the power, huge companies which can actually make an impact in community, right?
Absolutely, and they put all kinds of money into it, but it ends up being, they'll pick pet projects, priority areas for one reason or another, and so often they're not making decisions that are based in raw hard data that shows here's the inequities, and then measuring the impact, right? So imagine you've got, yeah,
They you need to have the KPIs too. It's not just
hmm
you spend
hmm
so much money on this, but you are also providing results you are getting. So that
exactly.
brings the circle part of your circulocity.
Yeah. Yeah. And for me, going back to that experience as a counterintelligence agent on the East German border, 1989, seeing people set free, it's really about, I approach this as, hey, there's this thing out there that called global health inequity. People are dying, right? And they don't have to. And they are almost imprisoned by poor health outcomes and shorter lives. And we can help set them free, right?
And that means the lack of support for the next generation, and the cycle
Exactly.
continues.
Yeah. Yeah, and actually one of my hopes is that in a planet where, we predict declining population and declining interest in farming by those children, is that corporations and governments will actually value health as, in saving, hey, we're saving future consumers. These 6 million children that die every year, from preventable causes could be buying Nestle and Starbucks in a few years. Not that we want that, but they are future consumers and productive citizens, um, and they can be set free. And it's also a fundamental human right, health, declared by the United Nations and signed by all the world's governments. Health for all is a human right, and so delivering it through a supply chain was just a vehicle, right? Hey, we can do it through the supply chain, and that will disperse into the communities because the coffee farmer lives in a village, and if we improve the health system in that village, he will benefit or she will benefit, and so will the community. Right. So just a very valid way for addressing health inequities in general. And the UN SDGs are really created for countries, right? And so companies, corporations can try, and again, they focus on priority areas, but often they're not leaning in that direction because they don't have the data. Yeah.
Which was a really emotional turning point for you to start these two companies. Can you share that with us?
Well, it's a little embarrassing. Not too much. I drove for Uber in San Francisco for 2 years. I was growing tired of being put into a corporate box. And for me, that corporate box was often a regional sales manager of whatever, and I worked for startups in the San Francisco area. And so you get tossed around a little bit by those startups. And I got tossed around by one and was laid off because they decided to pivot into a different method of growing their business, which is fine. So I jumped in an Uber to keep the money coming in, and I loved it. And that gave me a ton of time to think. And I had already been kind of working on the concept, and I don't remember where I was driving. Exactly, if there was somebody, a passenger in the car with me, but I remember that, oh my God moment where I realized, hey, I'm thinking about this thing that could really save lives. And that's the metric, right? That's the final metric. We can measure days lost for absenteeism, increased yields, increased health outcomes, but ultimately what we're trying to do is have impact and measure saved lives, And so I would kind of unite that aha moment in an Uber with going out into the field in Uganda on our first pilot program. And the first person in that pilot, we surveyed 800 people, and the first person was a middle-aged, maybe 50-year-old Ugandan man who came in on his, he didn't have legs, so he came in, and he didn't have a wheelchair either. He came in, moving himself with his arms. Assume people helped him harvest the coffee. And he hopped up in the seat, and we took his blood pressure. He had hypertension, 200 something over 170. It was just insane. And to see that man and to be there on the mission, was overwhelming, really.
Yeah,
Aside from like for me, it was my first trip to Africa, and Uganda is known as the Pearl of Africa. And I was that first day, what we spent about 3 or 4 days in that southwest corner of Uganda. There's coffees falling off the trees there, and it's widely known as some of the best coffee in the world. And off to the southwest is this, I can't remember the name of the mountain right now, but that volcano, one, you're near the gorilla parks, which is an important industry for them, saving those gorillas, that industry and that biome. And I'm on the border of Rwanda and the Congo, so not only this incredibly rich agricultural area, I saw this the other day, these countries aren't poor, the people are poor, the countries are rich. All right.
I'm just thinking coffee is falling off the trees, and still people cannot afford a wheelchair,
Mhm.
and everybody needs coffee.
One of the things that happened to occur about a month before I went over there, this was in November of 2023, was Starbucks had in their stores a little pink bag of Renzawari single origin. Renzawari are these big mountains in western Uganda. We knew the Ugandan supplier, and it's actually a division of a big Swiss company that supplies Starbucks Renzawari single origin. And I happened to be in Panama and uh, in Mexico at the time, traveling around, actually live in Colombia, and it was on sale in the Starbucks stores for um, $21 for an 8 ounce bag, a 250 gram bag. So that's $84 a kilo of for roasted. And I was like, oh my god, I wonder what the what does the supplier make? And it turns out that it takes 5 kilos of red cherry uh, to make 1 kilo of roasted, and they're getting paid maybe $1 a kilo of red cherry. So they're getting paid maybe $5 for 5 kilos that creates a 1 kilo of roasted that's getting sold for $84. And not much is done for them. The companies, and again, you've got to celebrate any effort to be more sustainable. That's where they typically are focusing on is sustainable agriculture efforts, right? And being, regenerative soil and organic and helping train the farmer to be more sustainable. But I don't know what specifically they do for their personal health, which is, you know, quality of life.
That needs an infrastructure, and it's hard to build an infrastructure at such limited income source, right?
A long-term focus on securing that coffee and cocoa and tea supply, right? So a 30, 50, 100-year time frame. And it's just, yeah, it's a data dashboard that they can use to visualize risks. So kind of the same thing. So what happened was as these two organizations evolved, Circulocity has become a field data collector and visualize that data, and then we make recommendations and we can help you implement those projects and then go back and measure the impact. And then simple is here's the tool, you can use it on your own for whatever you want, right? To measure and manage sustainability in your supply chain.
Pivoting a little bit, how much is AI playing a role in your company and in your data analysis right now, or what is the future? How do you see it going forward?
Yeah, one as a data collector, right? We use it to help us collect the data, particularly from these dozens of different sources, and then displaying that data, being able to review from a generative or predictive, using that to identify future risks, existing risks, outliers, because there is just no way that, I mean, I and you are the same, we're so busy. There's so many distractions. And so it's really about AI for good, right? And it's not a difficult, and again, it's not rocket science. It's about pulling the data in and displaying it and identifying risks. And so wherever a machine can help do that, it just makes us more efficient. Again, remember, it's cutting down those process steps and making sure that, Vice President Joe of sustainability at company, coffee company in Switzerland doesn't miss those indicators.
Yeah, absolutely. And our role comes here when asking the right question to the AI.
Yeah, absolutely. And even and that's even the more complex solution. The simpler solution, that simple check is, hey, build me a checklist to ensure the quality components of my store appearance, kind of thing. So just using a chat GPT tool to build a checklist, and then you can go in and modify it, right? And of course, you have a checklist builder, and then it gets deployed, and you can use AI to tell me who hasn't filled it out yet, right? Kind of thing.
What is the industry challenge, and what is your challenge for this transformation?
Yeah, I think the biggest challenge for industry is wanting to do something, needing to be able to decide what to do, right? And I'm thinking in terms of corporate social responsibility. They face requirements. Those requirements are loosening as we speak. In terms of ESG reporting, and because companies push back on any type of reporting requirements because it costs money, right? So that challenge, and I think you'd see this in any sustainability and kind of leadership role, is communicating internally and externally, that the sustainability portion is good, but it's not about producing, results that positively impact the bottom line this quarter, which is what drives the C-suite, right? It's about preserving even the ability to source coffee and cocoa in the future, in a climate impacted and a population impacted world. So that is like the biggest challenge for industry, is what to do, why, and how to make that, how to buy that message, right? What's the strategic thinking? What's the futures thinking that makes the C-suite open their pocketbook and continue to invest more in sustainability actions and what we call anticipatory actions, right? And then for us, those challenges are an opportunity, because we can give the corporations a tool, getting the word out and showing corporations that here's tools that, gives you data based decision making and measure the impact, which is the challenge in a lot of departments in any company, right? Even in marketing. Hey, we spent $1 million on billboards. Aren't they pretty? How much did it increase sales? And you can't say that billboard. So yeah. So and then so it's really about getting them to see, here's how you manage the risks, and here's how you build for the future, that goes beyond the next financial reporting quarter and into the life and existence of the long-term life existence of the company.
Did
Yeah. You mentioned Peru, and we did a project in Peru, and it was fascinating. It was a palm oil plantation owned by an American company, which is actually kind of a shell company, and the funder was a Norwegian family office. And it was 11,000 hectares, so something like 25,000 acres of palm. Controversial for its history of, it had been deforested land 10, 15 years ago, and the communities and the environmentalists weren't going to let that go. But what was impressive to me was the work that company had done, and knew about their employees, their health status, from their HIV status of high. These workers came from outlying cities, and stayed on a barracks on the palm oil plantation, which was 2 hours from civilization. 7% HIV rate, and the communities themselves high rates of anemia for poor nutrition. And the community, the owner of the palm oil plantation, had invested extensively in clinics, building clinics around, and internet, and water sourcing. And we went and looked at, we analyzed the clinic quality as part of our work. And so I walk in this clinic with my mobile checklist application, and there's a scale for measuring weight and a thing to measure height. And the scale had no batteries in it, and the thing to measure height was essentially a broomstick, and it didn't have numbers on it, right? So it's said, hey, we're doing stuff. We don't know why. Sometimes it's to comply with government, health department requirements for clinical quality. Are they doing the right thing even? And then what happens at the clinic level? Are we doing the right thing? Was the big question they wanted to answer. And how do we measure the impact?
If you know exactly where to spend, it might actually end up having a positive impact. Then you see the results of that positive impact in the community and in the workplace and in your revenues. Then you invest a little bit more. It is impressive that you are on site seeing all this personally, and then you're using technology to bring it back, the whole thing together. It has been very insightful for me. Yeah, count me impressed.
Yeah, thank you.
You spoke about the future where the regulations are probably going a little bit on the negative side. What does that mean to the industry? How do you see the industry and yourself growth wise in the, say, next 12 or
Yeah.
24 months?
Yeah, over the next period, it's okay for us because we're still, kind of launching and establishing a baseline and a presence. I think that the pendulum will swing back the other way. I come from an industry, testing, inspection, certification, where most of what was done in terms of I've got to test this device, this seatbelt or this car or airplane component or food product, I have to, right? It's about buyer's requirements, meaning that standard requirements. And then there's things I want to do because it's best for our company and best for our planet. And at some point, so that I think that pendulum swings back in the near term, hopefully without too much disaster being brought upon the globe, and that we see and companies recognize, and they'll have to do it together, right? Because they are competitors. Hey, this is about securing our coffee supply. We're the ones that we sell it all over the world, or our cocoa product or our palm oil product. It's about, I mean, we've known this for a long time, right? Not destroying the planet, but really securing that supply over the next 20, 30, 50, 100 years, 200 years. What do we do? And I think One Health is the way to go. Human health as an anchor for that, because it really is. We can dream about AI and robots doing all the work, but probably for the rest of our lives and the next couple of generations' lives, it's going to be human hands.
Primary
Yeah,
producers.
yeah, those primary producers. And so, that's my hope is that things swing back the other way. And it's not done so much, the good thing that, the needed doing the needful thing is done because it's the best thing for my company to do to survive, to be sustainable, right? And I like to call that deep sustainability, right? It's about preparing the past, but also preparing for the future and that in bringing environmental, social, and economic sustainability onto the same page. And again, it's got, we're selfish human beings. Our companies are built to be selfish and driven to grow. So optimizing production and producers is good business. Yeah, yeah. I mean, we talk about, the millions of wasted lives and millions of what you call disability or adjusted life years, right? Wasted lives that are not optimized for being the best consumers in the world, right? Which, again, we don't necessarily want everybody to be suffering from diabetes because now they're great consumers of those products, but optimizing people's life, delivering quality of life, happiness. We just celebrated World Happiness Day, and that's part of the Declaration of Independence. Life, liberty, and the pursuit of happiness, and is a fundamental human right. So health, not just human, but environmental and animal health and welfare is a huge part of that. And I'm happy to be doing something to try to contribute. Yeah.
If there are people who are interested in sustainability and global health and helping the primary producers, what would be your advice to these new entrepreneurs?
Well, I think, particularly in tech, and I think, if your focus is on diagnostic or treatment technologies, pharmaceuticals. I think there's opportunity to approach the same type of companies we're approaching to get them to help with implementing solutions in areas of the world that are clinical or diagnostic or treatment deserts, as well as utilizing, you know, uh, things like local production of vaccines and treatment technologies or diagnostic technologies, like developing, technology in Africa to be sold in Africa, right? Uh, take Brazil, to develop, and so kind of, I wouldn't say compartmentalize, but localize is the word. Localize your business so that it can help major corporations address these sustainability issues or participate in the solutions, alongside government, be able to even have an edge over competitors because you have that kind of global focus, that long-term focus to help organizations survive whatever's coming. That it's change. We know how good or how bad things will get. They'll come back, and who knows what kind of a planet we'll see as time goes on, or what our children and grandchildren will deal with.
We don't know what our children are going to deal with like next 5 years, to be honest. Yeah,
Mhm.
it's how things are changing so fast. And hopefully this is the time where the thing dramatically improve. So as we come to an end, if you have a 90-second speech, we can perhaps end with that.
Yeah, well, we would certainly love to be speaking with anybody in your audience in terms of potentials for partnership. We need to connect. We want to connect. We want to have discussions like this with even competitors, but also technology provider and those end clients. We are still two young organizations and growing fast. We recognize that it's again a huge global effort, that we can't do it alone, and it takes partnership, and that's UN SDG 17, partnership for the goals. The industry my background was, if you want to make a change in the world, you've got to have the retailers involved, the consumers involved, the technology manufacturers, the primary, the agriculture, commodities, government involvement, philanthropist involvement. So I would invite anybody to reach out to me. I love meeting people and having discussions and seeing how we can help. And so, whether it's collecting data in a supply chain on health indicators or human rights or nutrition, other SDGs, sustainable development goals, or, from the Circulocity side, or if want help collecting emissions data from your supply chain or, other indicators, we're certainly well positioned to do all of that. And again, in partnership. We know if we do the right, yeah, we know if we do the right thing, the finances will take care of itself.
Thank you very much for your time, John. It has been extremely enlightening.